Hi, I'm Dr. Sia, and here on the Dr. Sia channel, a question that we'll be answering is what causes people to suffer from psychological and psychiatric problems? Well, to do that, a common psychotherapy that I'll be showing you is cognitive behavior therapy. Now, for some of you, you might go, oh yeah, I heard about this before, nothing new. But for some of you, this might be really new. So cognitive behavior therapy, also abbreviated as CBT, is actually two different therapies put together. So cognitive therapy is a therapy based on the idea that it's our thoughts that cause us to suffer. And if we can just fix our thoughts, change our thoughts, then we won't be suffering as much anymore. Now, behavior therapy is the idea that in the end, what we do and how we behave is what causes suffering. So if we can change the way that we behave, then we won't be suffering as much anymore. Now, in the beginning, when these two sort of therapies were in existence, they were combating a little bit because the cognitive therapists were saying, no, in the end, it's what you think that matters. And the behaviorists were sort of saying, no, in the end, it's what you do that matters. But then some genius, and I don't know who put it together first, decided and said, hey, everybody, let's stop fighting. Maybe we can put them together. So there you go, and that's how you got a fantastic therapy called cognitive behavior therapy. So what are you to expect if you go to a cognitive behavior therapist? Basically, you're expecting that your cognitive behavior therapist will help you develop more rational, scientific, and helpful thoughts in situations where perhaps your thoughts tend to be negative, overly irrational, and unhelpful. Now, the same therapist, the cognitive behavior therapist, would also help you develop some helpful skills to better deal behaviorally with those same situations. It all becomes very abstract. Let me give you an example. So a cognitive behavior therapist would, for example, say that you tend to feel a bit anxious when you have a speech coming up. All right, so this is something I think a lot of people can relate with. You're about to go up, speak in front of 10 people, and you're feeling really nervous. Now, for some of us, that's normal to feel a bit nervous. But for some, they can experience a crippling fear. A fear that is so strong that it wouldn't even allow them to go up and speak in front of everybody. So what would a cognitive behavior therapist help you do? Well, firstly, they'd help you say that your thoughts are not being very helpful to you. So you might be having thoughts like, everyone is going to judge me. Well, they would help you look at that, the scientific validity of that, the rational nature of that, and whether that is helpful or not. So after that, you might actually develop the thought instead when you're going up that, look, some may judge me, some may not. There's no way for me to know. But what is helpful for me is to say, actually, you know what? It's going to be fine, for example. Now, that might not be enough because as we know, you also need practice. Because you're going to go up there and you're going to tell yourself it's going to be fine, it's going to be fine, it's going to be fine. But and as you all know, once the feelings start taking over and that anxiety sets in, it's not going to be fine, it's not going to be fine, it's not going to be fine. That voice tends to be the louder one. But what a behaviorist helps you then do, the cognitive behavior therapist, the behavior component of therapy, is that it helps you go to that situation, practice that situation, perhaps maybe with 10 friends, or maybe just imagining that there are 10 other people there, or with some of the treatments that I've developed lately with virtual reality, helps you be in that situation so that you can even learn to have these helpful thoughts for you while you're giving your speech in front of people without feeling too anxious. So just a neat little example there on how cognitive behavior therapy can be really helpful and useful and what it is as well. Now there's so much more that can be said about this fantastic evidence-based therapy. If you want to know more about it, drop a comment in the video. Let me know what you want to know. Of course, I'll make a video on anything reasonable and sensible. I'll make a video about it. So just let me know, all right? Don't forget to like and subscribe, and tell your friends to like and subscribe. Thank you. No, I really mean I'm waiting for you to go and press like and subscribe. I'm sitting here waiting. It's getting awkward between us now. Can you go and I'm joking. Okay, bye.